Good afternoon, all. Good afternoon to our viewers. So today we will be talking about prisoners and their healthcare in Nigeria. And your anchor for today is Obichioma. And we have our guests who are here to discuss this topic with us. We have the ED of CAPIO, who is Reverend Father Jude Isiguzo. He is here with us. We also have pharmacist Adobe Annie Enugu. Yes, Annie Enugu. So she's also here with us. And we also have Princess Ada Ozowuru. She's also here with us. She's a nurse. And they are all members of the medical team of CAPIO who volunteer for the medical outreaches. So today we'll be looking at the activities that CAPIO does in terms of providing medical intervention for prisoners in the custodial center. So I'll start first with Father Jude, and we would like to know about CAPIO, what CAPIO does, and why CAPIO is interested in prisoners and their health care.
All right, thank you so much, and thank you for having me today. Carmelite Prisoners Interest Organization, CAPIO, as we call it, is a non-governmental organization that promotes the welfare of inmates in Nigeria. Now, this welfare, when we talk about the welfare of inmates, it cuts across their legal rights, their health, their social welfare, and also their rehabilitation. Now, given the fact that in Nigeria, the custodial centers, as we all know, is not in good shape, in good situation, inmates who are there suffer more because attention is not given to them in terms of taking care of them. In Nigeria, we believe that the best way to punish a criminal or an offender is to deprive him or her some rights, some human rights, which ordinarily shouldn't be the case. So we now see that inmates who are in custodial centers will not have access to even ordinary potable water. They don't have access to medical care. They have no access to all things that humans supposed to have free access. They lack those things just because they are incarcerated. So we as an organization took it upon ourselves to say that these inmates, in as much as they are incarcerated, shouldn't lack the basic needs. And these basic needs are what? Health. It is said that health is wealth. So one who is healthy is already yes. So we see that their condition is so deplorable, is so pitiable, and we say we can't just watch them die. We can't just watch them suffer like that. Of course, being now our Christian faith also demands that we try as much as possible to fulfill the injunctions of our Lord Jesus, especially in the Gospel of Matthew, chapter 25, verse 36. I was sick, you visited me. I was in prison, you came to see me. So these are the things we try to live out by attending to these inmates. Now, the conditions of the custodial centers, I'm sure you visited here. So you yourself, the first time you entered there, how did you feel?
As if I was losing breath.
Yeah, that is it. So when you cannot imagine these people who are there, living there day and night, sleeping there, in their cells, their convenience, and I won't use the word convenience because it's not actually convenience. So I mean, where they take their bath and their toilet is also within the cells, but it is a mess. Then they don't have access to water to keep it clean always. Now you can imagine where you have hundreds of inmates in one cell, sleeping there, eating there, breathing out and breathing in together, how do you think they will be healthy? So you now see that. And again, the Custodial Center ordinarily should have a good clinic, quality clinic, and medical personnel too.
Okay, I guess
but these are lacking.
Yes,
so it is because of this lack that we now feel that it is important we step in, at least to fill these gaps that we noticed.
Okay, so that's very good. Thank you very much. So we have established the gap that, the prisoners have a need to be healthy in as much as they are serving their term in those custodial centers. So going over to you, Pharmacist Ada, you've been a volunteer in CAPIO. For how long now have you really worked?
I think I have been opportune because I'll see it as an opportunity. So I've volunteered in CAPIO for over 10 years. I think I started when I was in school. I really enjoyed coming out to help out, to visit the prisoners. Like Father said, the injunction of our Lord Jesus Christ visited me in the prisons and all of that. It's been a good experience.
So what does the medical team constitute of? Like, people make it up?
Oh, perfect. Yeah, so we have the doctors, we have the nurses, of course the pharmacists are there as well, and of course the physiotherapists and the med lab scientists.
They all work hand in hand.
Yes, we work as a perfect team.
Okay, that's very nice. So I'll go to you, also Nurse Ada. I would like to know, during your visits in these custodial centers, what are the illnesses that you usually encounter?
Well, we encounter acute diseases, chronic diseases, malaria, typhoid, skin challenges. We've also seen people with kidney challenge, hypertension, diabetes, skin conditions, and also eye problems and challenges.
And these are the categories of care that CAPIO provides.
Yes.
In those, as they go there for the interventions, these are the categories of diseases that they actually provide care for.
Yes, and they also go a step further to get the referrals, possible referrals. Of course, when there's a need, they would ask the doctors to refer, and they would go ahead to make that happen for the prisoners, to make sure that they eventually get to the hospitals that they were referred to. And I also want to think further that you pay the bills as well.
Oh yes, very well.
Financial support.
They do a lot, I would say. So they do all of that. So they make sure that patients, if they need to go out of the prisons to meet up tertiary hospitals and all of that, they have to make sure they do that. They receive all the drugs.
Okay, so what are the possible challenges that you think that these prisoners encounter to be able to access this healthcare?
First off, I'll start with that. The prison clinics are very ill equipped. As much as or as little as glucometer, I'm not even sure it's available. Even if it's available, they'll tell you that there's a battery problem or that they don't have strips to test for diabetes, which is like a very common thing that even pharmacists have, right? And then, of course, the professionals, they don't have, so far I've been going, I haven't seen doctors that are prison doctors or prison nurses. So there's zero, I'm tempted to say zero staff presence there, right? And of course, availability of drugs, they don't have drugs. They don't have drugs. I'm sorry. I mean, it costs so much.
Well, I would think that, yes, doctors, they don't have, but nurses, they do.
Are you sure they're qualified?
Yeah, but again,
there's a difference between having
is
nurse and
they call them health workers. That's what they have.
And they don't have a complete team because it's not just about having nurses. You should have the doctors, pharmacists, nurses, physiotherapists,
med lab,
specialists,
and then have specialists that will come to visit. So probably, for example, every month there's a cardiology visit there, an endocrinologist, there should be that nephro, ophthalmology, so this gynae even because we have a couple of gynae cases there as well. So these are things that are very important. I think that
Needs to be provided.
yes, excellent, yes.
Okay, so
And also infrastructure.
okay.
The clinic facility, the building is poor. There's no ventilation. It's so small. there's no ventilation, and we have some cases of tuberculosis, and we are facing them face to face, no distance, there's no social distance there. Then talking about infrastructure, they have toilets there, they don't have water. So how would you use the toilets? And definitely we see a lot of skin infections, toilet diseases, especially amongst the women. When they come, most of their complaint is candiditis. Candiditis, I know it's infectious. Then skin challenges. They still come again with scabies and the rest, sharing the same toilet. I don't think their units, their cells are being fumigated. So most times you see malaria, repeated malaria, then when everybody coming there has malaria. So they need to be fumigated. Then once in a while, I think their toilets should be washed with hydrochloric acid to reduce some of those whatsoever that will cause
every week. No, if not every day.
Let's say
every day because
because of finance, there should be fumigation and washing of their toilets with hydrochloric acid to reduce some of those infections. But again, some of the challenges there is, our system is already, let me say, damaged. So we have a very bad system. So when it comes to allowing some inmates to come for
the critical ones,
to come for when this NGO visits, to come and see the health team, it becomes very difficult for them because you have to tip some of the warders there to be able to come out. And also, when we even get the drugs, when they come to see us, for those that are a bit healthy, pretending to be sick, when they come to see us, when they come to see us, those drugs that are being dispensed to them, they go and sell it to the critically sick ones among them.
And of course, they are poor; they can't even afford it yet.
So whatever the amount is, they collect, because even coming out to get the drugs, they tell them when they come out, they also demand for something from them before they give them the drugs. So that's a very big
but then to say something on the issue of not being hygienic and issue of water, now we are using specifically the Custodial Center in Enugu State. It is not the same across the country. Other Custodial Centers, they have access to water because they have a water bomb. But here, Enugu City, there is no water, and they suffer that a lot. But that is not a reason actually why they shouldn't keep their cells clean and all of that. But the point is that the water that is being provided is being sold to them.
Oh Jesus!
That is where the whole issue is. Now they have, let's say, a bucket of water is provided for the whole cell to share for the whole day. So if you need more than that, you have to buy. So now those who don't have money to buy, they have no choice than to remain like that. That is why you see people queuing up at the well. They buy because they pay for it, and not you can buy it cheaper outside than inside the Custodial Center. So when somebody who has not seen money to eat food, you are not telling him to go and buy water, to wash clothes, to wash the toilet. So these are the things that make hygiene difficult there. Made them to be neat, made them to be, to always be falling sick. Even now.
Yes. In that environment, naturally, you're going to get sick. It's a very natural
the natural spread too.
Exactly. Because of course they're all packed together and also.
And they are overpopulated in itself.
Yes.
Yeah. Okay, so further going forward, we want to know what CAPIO is doing to be able to provide for the logistics for this medical outreach. I'm sure that whenever CAPIO is going for that outreach, there are supplies that are made to be able to meet this medical needs. So can you tell us more about it?
All right, CAPIO, we do a lot to see that the medical outreach is being sustained, and is really is costly to do that. But then an NGO now, we rely so much on donations, people generosity. Of course, we write proposals seeking for funds, seeking for support. So, for example, there's this religious congregation called the Sisters of St. Peter Clever. from time to time they fund the medical program we do. Then we also write to pharmaceutical companies asking for donation of drugs. And then individuals too donate money. Now, when we get all of this, we'll be able to buy drugs. But then what of the personnel? I think this is the key to the whole thing. Yeah, because you may have all the drugs and you don't have the personnel to attend to them. So we have a team of medical volunteers. They volunteer that time. Ours is to provide the medications. So they come, provide their services, provide their time, and attend to the inmates free of charge. They don't collect a dime from us. And it is on that note that I want to specifically thank the medical volunteers of CAPIO. They are really doing wonders for us. Without them, we won't be able to achieve all that we are doing in the custodial centers. Just last month, which is September, we had medical outreach here in Enugu Maximum Security Custodial Center, and some of the doctors who came for the first time, they were asking me, Father, how do you get resources to fund this? How do you get medication? Because they were marveled by the number they saw, and then how we are giving the medication free of charge. And they said that the medications these are quality drugs, not just cheap quality drugs. So how do we? So to them it is something great, something marvelous that we are attending to the inmates. Some of them say criminal, some of them say who rapists, some of them, and you
human beings.
But they say they are human beings. So in as much as they are human beings, we have to look after them. So this is how we get the resources that helps us to carry out the medical outreaches.
I mean, I'll probably say something there. So really, this will be my opportunity to say thank you to CAPIO for doing all they've been doing, all the things you've been doing, right? And of course, my fellow volunteers, also appreciate it. But this outreaches, they happen a lot. So sometimes at least minimum of 4 times in a year. And for each time it happens, the drugs cost
millions, yes.
I can say it for a fact. It's in millions of naira. So thank you, Father, for all you do. Thank you.
Thank you so much. Thank you.
Well, thank you for giving us the opportunity.
Yes. Because it feels good to give back to society, have an opportunity, have a space to do that.
Is I think some medical personnel still have that phobia of prison. Once they have prison, they say, Father, I'm not coming. Prison.
When I invite people,
they hardly come because it's prison. That fear to come there and be the same. Say if it's outside, I will come, but prison. So you see that the team we already have, they have been consistent and they're committed to the. So we still ask for more volunteers to join the team.
Exactly. So Ada Ozawule, have there been learning points, by virtue of your constant volunteering in this medical outreach? Has there been things you've learned in the process?
Of course, so many things. You can
share with us.
Well, sometimes when we take care of those people, we even find out that some of them are not even guilty of what brought them there. And also we learned some other disease conditions, and going by our way of treatments, there are some improvements. So many improvements. We even say, CAPIO is around, we are coming.
Exactly.
Immediately you are entering the gates, they'll keep telling you, we are coming. And it's something that will make you happy that you are giving out and something good is coming out of it. You'll be encouraged to come back the next time. As in, maybe when we enter, say, is it CAPIO? Please go back. You'll be discouraged, but you are putting in an effort and you are saying something good coming out of it. And in fact, you learn a lot from them. You find out that being in the prison is not just being humiliated, being in a place. You find out that being in that prison, when you come in to see them, you see them happy. They are not friends. Make new friends. You find out that not just being in the prison makes you look downcasted, unhappy.
Yeah.
These people are people like, they are human beings like you.
And your presence is also a source of encouragement.
Yes, it makes them really happy, I must say. And like she also said, it makes me happy when I go, because I mean, I've given myself to people, free of charge, in quotes. I'm always very happy doing that. And also, they've taught me patience, because trust me, when we go, they can be a lot, And they want to scream. I remember, oh, okay, fine, it's fine. I'm gonna be nice to you. So that has also been a very good turning point for me. That they've increased my patience, and I love that about them. And like you also said, they're very friendly. I have a couple of them that are friends already. Like whenever I come, they know me. We're hearing ourselves. I know. It's beautiful. It's beautiful. I go happy. I leave the prison happy. I may leave tired, but definitely happy. And one more thing, the team. I've made friends with the team. I mean, I always look forward to when I come and see it. I'm all very happy. Yay, stuff like that. So it's beautiful.
Yeah. So giving an opportunity, like to inform policy, things you want the government to really look into, to be able to improve the welfare of prisoners. What are those things that you could, suggest?
They should work on the clinics.
Expansion.
They should expand, make it very big. I mean, obviously, as much as it can be. Then, of course, the equipment, the machines used, they should provide all of that. Right. Then, of course, the staffing, they should staff
manpower.
They should staff the clinic with highly trained, not just ordinary. They said that and also highly trained professionals, and competence. Please, yes, very important. Now, not just doctors and nurses. Obviously, you need pharmacists, you need the med lab scientists, you need the physiotherapists, you even need the there are several other in the team, psychologists, yes, and then of course, very important because some of them are quite different there, to be honest. And the thing of having specialists pay visits, if it's monthly or weekly, something like that would be lovely.
And also, the government should also be checkmeeting the prison. They shouldn't also inform them when they are coming. Sometimes they should just give them a surprise.
Nigerians like
to give that surprise. It helps them to know where they have lapses. Because if you tell me you are coming to my house, I begin to clean, arrange, make sure everything is in order. But when you just give me a surprise visit, as in let me see how it's being done here. Exactly. We make a lot of corrections, and the system will get them.
Exactly.
And then I think too that if the federal government will step in fully through the Federal Ministry of Health, if they'll be able to begin to be assigning doctors, nurses to these custodial centers, it will go a long way. So just as they employ staff, doctors in hospitals, they can employ these people to work specifically in those custodial centers. So in that way, the person will know that he or she is employed to work there.
Every month,
he gets salary for working there. What the others get. But the challenge is, I think, is it early this year or last year something, our president was trying to increase the number of doctors that will be working in custodial centers. But when we did the calculation, we saw that it is about 2 doctors in a state. Now, in Enugu State, we have 3 custodial centers plus farm. They have a farm. So this is 4. So how will 1 or 2 doctors cover all of these places? So they have to be moving from one custodial center to another from time to time. So even as I speak to you now, it's like in Suka Custodial Center, no doctor there. So it is only maybe a God-spirited person decides, oh, I'm a doctor, let me visit these people and see them and see if I can offer some services there. So there is need for federal government to employ medical personnel specifically for custodial centers.
Custodial centers, I think that sounds better.
Okay, so thank you very much. So thank you for all the detailed insights you have given us, for our viewers who have not had the opportunity to visit, one of these custodial centers. I'm sure by just seeing this clip, they'll have an insight and also will be motivated to do something, either volunteer to be part of it, or even in donations also to be able to support the work that CAPIO does. So thank you very much for this session.
Thank you.